Hi and welcome back. I have a question for you. Are you frightened of fillers? And if you're frightened of fillers, why are you frightened of fillers? I know why I'm wary, but I'm here with an expert, the absolutely brilliant Dr Wassim Taktouk, and we're going to bust all the myths about fillers. I should be really transparent and say this video is sponsored by Teoxane, and you're going to find out why in a minute, because we're going to be talking about the new generation of fillers, how they're better than ever before and how you shouldn't be frightened of them. But that's not my job, that's this man's job.
So yeah, my background is as a GP, and after I did some training in dermatology, and then went on to work in A&E for about 10 years, while I started my aesthetic medical practice, which I grew a great love for, and now I do only that.
Why are we frightened of fillers? Because I have to say, you and I created some funny stories together on my Instagram, and we're going to end up this entire video with some fast and sharp, quick-fire questions, answering all of your questions, because you had some incredibly smart questions. But the most common one was, I'm frightened of filler. Why are people frightened of filler?
I think people are frightened of filler because they've seen overfilled faces. That's pretty much it. And I think the way to break that is to make people really understand that the reason that they're not seeing more of it is because the rest of the work is done quite well. So good work should be undetectable. Someone should look rested, rejuvenated, can't quite put your finger on what's happened. That's the good work, and that's the stuff that you don't see. People only see the bad stuff, and that's why they have this idea.
Listen to that, play that back and listen to that again. The reason you're frightened of filler is because you only see bad filler. And if I think, and we shan't name names, but if I think a generation of women who are in their 40s and early 50s, that suddenly you look 10 years back and think that, my goodness, you haven't aged in 10 years, that's incredible. It's always that subtle use of neuromodulators, a little bit of filler and a little bit of laser work that works perfectly, doesn't it?
Perfectly. Sometimes it is a combination of treatments as well, so it isn't just one treatment fits all, and you have to find a practitioner who can use and be proficient in the different disciplines, and it's sometimes a cocktail of those treatments that is the way to go.
Let's explain what filler is.
So filler is hyaluronic acid. So hyaluronic acid is something that we naturally make in our own bodies. We're churning it out every day, but we break it down sort of every 72 hours. Filler is taking that hyaluronic acid and essentially modifying it in a way that it lasts longer, so your body will eventually break it down. It just takes a very long time to do it.
And explain what's specific about Teoxane RHA, which stands for resilient hyaluronic acid. Now, you all know hyaluronic acid, you're smart, I know you're engaged, you know it in the form of a serum that you put on your face every day that locks water into your skin. So how does that hyaluronic acid serum differ from the Teoxane RHA?
I think with Teoxane they went back to sort of the drawing board and thought, how could they create something that would be a little bit a step ahead of the other fillers, and that's that we had never really ever considered the fourth dimension. We didn't consider people moving their faces. So you would sit down, you'd be injected, you'd sit up, you'd take a picture, but then someone would go and walk away, they would smile, they'd move their face, and the filler would be obvious then. So you had to sort of work around that and find a filler that's stretched and moved with the natural tissue, and that's what resilient hyaluronic acid is. So it's able to morph into your tissue and move naturally with it. So it's undetectable, but obviously achieves the benefit that it needs to.
So if not all fillers are created equally, how can you ask your doctor, because we hate asking our doctors questions like this, to give you the filler you want? Do you have the right as a patient to go in and say, what are you injecting in my face? Can I take a picture of it with my phone?
Yeah, I mean, I find it extraordinary that people don't do this anyway. I find it extraordinary that you would sit down and not ask someone what was being injected in your face. You read up on side effects of medicines, you ask your doctor what they're giving you tablet-wise. Why wouldn't you ask what was in your face? So you absolutely must ask your doctor, and even ask them why they've chosen that product. So for example, we have a product that's designed specifically for the eyes. So if the doctor is using that, you know they've chosen the correct product. So it's just things like that I think are really, really important. I think it's not offensive to the doctor to be asked, and I think a doctor should give you a record of everything that you had. I mean, far too many times patients have come and sat down with me and I've said, what treatments have you had? And they've just looked at me completely clueless.
Have a look at that little card you've got here. So, depending on which clinic you go to, you should walk away with something that looks a little bit like this.
Absolutely. This is a post-treatment aftercare card, and in there we put the stickers of the treatments that we used. It's a good little sort of guide.
So is it a little bit like your vaccination card?
Totally.
That's so clever. So
we should have an app.
A little sticker that comes off the product, and you put it into that card.
Yes.
And also, can I just say, if you find a clinician who you work with brilliantly and you love their work, but if you do want to move on, the next clinician you move on to should have this sort of information. That's fascinating.
Well, they have to know what they're putting their needle into. So if there's something in there, we need to know what it is. It's also from a safety point of view. And if your healthcare practitioner doesn't have access to the post-treatment aftercare cards, you can just take a photo of it with your phone. I don't think anyone's going to take any offence to it. It's the right thing to do. It's the safest thing to do.
I love that. Listen to that. It's good advice. A really secure, brilliant healthcare provider that's injecting your face will not be offended if you ask questions and intelligent questions. So we're going to arm you with the right questions. There are different types of filler. And at this point, Dr Wassim is going to talk through all the different fillers, and we're going to drop in some pictures because you'll be fascinated to know how different they are. Talk about the different, is it almost fair to say the densities of fillers and where they go in the face?
Pretty much. I think it's sort of the thickness of the filler, the texture of the filler, it's the rheology we call it. But,
rheology?
Yes.
It's a new word on me.
Fancy. But what we're looking at is, we're ultimately tissue matching. So when you look at the face and you understand how the face ages, you look at the different fat compartments that have changed, the ones that have deflated, what the consistency of that fat is, and that's what you mimic it with the correct filler. So for example, the deep fat in the face is a much more rigid fat that doesn't move. So you'd use a denser filler in that area, whereas the superficial fat, which is the fat that's just on the surface, is a stretching and moving one. So you have to put one that stretches and moves in that compartment. So that it's kind of tailoring it almost to which part of the face you're going to use it. And we have a really, I mean, I'm just saying it's the greatest range of fillers. It's all the different densities for the stretch compartments and one specific for the deeper fat compartments. So it's almost like tissue matching.
So how many categories have you got?
So you have the resilient hyaluronic acids, that's our stretchy filler, that's the more superficial injections. And then you have the deeper fillers, which is sort of the slightly older technology almost, but still brilliant and robust and really gives that lift and that projection. And those I think those are the two main technologies that we use.
Okay, now we're going to talk about, you asked me to bring some pictures in, and I'm going to drop in these pictures here as well now. Because some people say to me, in fact I get it a lot, if you have good skincare, you don't need to see an aesthetic doctor. Tell me what's happening in someone's face over time, which is why you asked me to bring in pictures of me in my 20s, 30s, 40s, 50s, etc. Because there are fundamental changes in your skin going on and actually your skull at such a deeper level as you age, and how filler can actually adjust to that and correct that. And you've got a little friend on the left.
I do have a little friend. Let's bring my friend along. Right, what should we call my friend?
I don't know. If we've got, what do you call the plant earlier on?
Keanu leaves.
Keanu leaves. Please, suggestions for this skull.
Yes, we need a skull suggestion. So basically you have to really think about how the face ages and what you're replacing with the filler, and that's the key step one. As the face ages, as time passes, what we get is this mid part of the face, which is called the maxillary bone, starts to move backwards. Once you understand that, you understand that the filler that goes deep down has to almost replace the space that it's retracted, and you're going to use a much denser filler in that deep compartment. The fat above that, the deep fat, will also get smaller, so it's ideal to use that deeper filler. But then you have a layer of muscle, then you have the superficial fat, and that's where the stretchy fillers are going to go. As you get older, this round hole, this orbital opening becomes wider. The piriform fossa, which is fancy for this nose bit, gets wider, our noses start to droop a bit. We get some bony resorption in the jowls. It's all very positive because we have solutions. we lose the angle on the jaw as well. So there are changes on a bony level, which once you understand that, you understand why people feel like their faces are coming down. It's not that their skin is. It's like, yes, there is an element of laxity, but actually it's all the tissues. There's 5 layers underneath that are changing through time that need to be replaced accordingly to lift that tissue up again.
And that's why you shouldn't be frightened of fillers, because fillers do something that nothing else can do. So neuromodulators can't do it, skin boosters can't do it, and neither can skincare, because what you're doing is you're actually replacing volume loss over time. And I'm going to drop in the pictures here. And you can not only see my volume loss over time, you can actually see my weight go up and down. Are certain faces easier to fill than others?
Yes, absolutely. I mean, a face that has quite a lot of volume loss would be a lot easier to fill. That's not to say that another one wouldn't be suitable for filler, but it's a much more straightforward case. I think with a patient that has a little bit more volume in their face, that's where the really key understanding in where the volume has lost and the replacement of that volume takes place. So most cases will benefit in some shape or form, but I think it's really, really important, like we just touched on. I mean, I think it's important that your practitioner asks you to bring in photographs, because we're not in the game of changing people's appearances. We're in the game of looking at someone, rejuvenating in a way that is respectful of their natural aesthetic. We see how things have changed over time, and we select accordingly and treat them accordingly.
So it's about giving back what somebody once had rather than changing the shape of their face.
Yeah.
Because I think one of the reasons that most of my followers are frightened of filler is because they see these examples of these famous faces who suddenly look so dramatically different. So yes, they are line free, but their face isn't the same shape as it once was. And that's an example of bad filler, is it?
I mean, it depends. I mean, patients come in all shapes and sizes like all of us, and some patients really want to come in and have an exaggerated cheek, or they want a much more, I believe the term is a snatched jawline. So these things happen. I was thrown by that when I was asked for it once. And those are sort of much more specific sort of beautification treatments.
Okay.
And you can target it a bit more, and you can give someone a much more sort of sharp, razor sharp jawline and so forth. So there is a space for that. But ultimately, I think that might be part of the problem when people's faces change dramatically, and that might be why there's a tiny bit of filler phobia, because they've seen quite a drastic change. But if you have sort of a more holistic approach in treating it, it doesn't need to be that way.
For my followers, I think the majority of people, and most of my followers are women, all they want is they want to look rested, they want to almost sort of turn the clock back, but not decades, probably just sort of 4 or 5 years. It's that sweet spot, isn't it, of thinking, whatever that moment was, if you take a picture into your healthcare practitioner and you say to them, right, okay, that's when I thought I looked my best, that's when I thought I loved the shape of my face and whatever was happening with my skin. Can you help me try to achieve that? I think that's the safe thing to ask, isn't it?
Yeah, absolutely.
Okay.
100%.
We need to talk about men.
Yes.
I do have a few men following me, and they are the most gorgeous creatures, obviously. I only have gorgeous followers. What do men get from fillers that might be different from what women ask for?
It's actually I find male filler treatments a little bit easier sometimes as well, because, you know, when you're filling a jawline, it's perceived as traditionally masculine feature to have a wider jawline. So, you know, you can really build on someone's jaw angle and widen the face. That's considered a classically masculine feature, should you want that. So I find them easy to treat, personally.
Do they tend to have more deep filler then? So more of the structural filler rather than what you described as that flexible RHA filler?
I do a combination. So on the sort of the deeper above the bone fat, I'd use a deeper filler to really lift the tissue. But then again, you want to volumize the tissue that's moving, so you almost multi-layer it, like a gâteau.
Like a really well-created cake. I love that. Yes, because when Wassim and I were chatting earlier on, I said, find an analogy for, I love this, let's use the cake analogy. Find an analogy for the difference of what deep filler, medium filler, superficial filler, and then even boosters, let's chat about boosters, and then skincare can do. So you're basically building this gorgeous multi-layer gâteau, are you?
Yes.
I love that.
Yes. Or a burger. A burger, like the table could be your bone, and then the bottom bun is your deep fat, and then the muscle is the meat, vegan, also if need be. Your superficial fat is the top bun, and then sesame seeds are the skin.
I love that. That makes complete sense. I think that works brilliantly, but also that makes complete sense to me because when people say to me, well, if you need good skincare, you don't need aesthetic work, and obviously I have had a little bit of aesthetic work, and I have laser work, and I have tested fillers in the past, and obviously I've had neuromodulators. To me, it makes complete sense because it's working on fundamental different layers of this perfect gâteau.
Yeah.
I don't eat red meat, so I'm going to stick with the gâteau.
Oh, the gâteau, okay.
I'm thinking the Great British Bake Off makes complete sense. You would win every time, yeah. That gorgeous cake comes out, it's like the showstopper, yeah. Let's talk about how hyaluronic acid sits in fillers as opposed to skincare, because obviously Teoxane has skincare that is based around the RHA. So before we started filming, you explained it really clearly to me that what's unique about the Teoxane RHA is that it's the closest to our completely natural inbuilt hyaluronic acid. Explain that to everybody out there.
Yeah, so in our bodies, we're always making hyaluronic acid, but our hyaluronic acid is made of longer chains. And what they very cleverly did in Teoxane was they were able to replicate these long chains and actually have very fewer links between the long chains, and that's what added to its stretchability. That's what allows it to stretch and move with the natural tissue. And as you kind of go up, as you add more and more links to it, the more firm it gets generally as a rule. But the consistencies can go from quite watery to really quite thick. So there are longevity changes, so that the thinner the filler is, the less it's going to last. and the more volumizing the filler is, the longer it tends to last as well.
And now on to boosters, because I think boosters are really interesting. I always describe boosters as being sort of almost like an injectable form of skincare. How do you describe them?
Totally, that's exactly what I feel they are. They're hyaluronic acid as well, but rather than having the chemical bonds in them that keep the hyaluronic acid in the same place as per your filler traditionally, your skin booster has these free-floating chains of hyaluronic acid, so when it's injected, it just starts to spread through the skin, really helps with fine lines, helps with the texture of the skin, the suppleness of the skin, and just gives the skin a bit of a bounce, a bit of a glow. Yeah,
I find it particularly good for crepiness,
yes,
because you can go fairly close to the eye. It doesn't change the shape of your face at all. It simply hydrates like the best skincare ever.
Absolutely. I think it's a good one for someone who is a little bit weary of starting any kind of injectables. I think it's a nice entry-level one because you're going to get really, really lovely skin out of it, and I think it sort of definitely helps to be a sort of a launch pad before you enter the world of fillers.
Is there anybody for whom fillers are not suitable? We're going to go on to answer all of your quickfire questions in a minute, but are there people who simply don't need fillers?
Yeah, absolutely. I mean, yes. I mean, there are. We all age differently. Some people don't have very dramatic volume loss, and some people will have quite a fair bit of fullness in their face as time passes. So there are certain circumstances where I wouldn't advocate the use of fillers. But there could be more targeted fillers in that case. So it could be that although they may have more volume in their face, perhaps their tear trough needs addressing. So there are different things that we can do with fillers. A skin booster would be suitable for someone who perhaps we didn't feel need facial volumization.
Now don't forget, for the majority of people, they're actually lying down on the treatment couch. They're petrified, let's be honest here. Mm-hmm. Little hearts going, right? They can't see what you're actually doing because you're
Very
up
true.
Here. So what actually does a box of filler look like?
Let's show them. Can we have some boxes?
And he said he couldn't catch.
I could. I'm just teasing, it's just in case. Look, this is your ivory and here's your platinum. This is what you should be looking for. This is your ultra deep and this is your RHA4. This is the deeper filler. This is the one that's going
This is for the jaws.
Yeah, the jaw or the deeper fat. The fat that's immobile and doesn't move. And sort of the deeper injection is almost on both. So that's going to be your deeper fills. And this is the resilient hyaluronic acid. This is the one that's going to stretch and move. So yeah, that's what filler looks like.
And what we're going to do is we're going to drop in some pictures actually of it being injected out into a mirror now so you can see the different textures. Not all fillers are created equal, people. Beware.
So when we talk about the rheology of the fillers, we're talking about really their texture and their consistency. Something like this is going to be a skin booster. This is going to be free chains of hyaluronic acid, and you can just see almost instantly when I inject them, it starts to spread. So when we inject this in someone's face, very superficially, it will start to spread through the skin and coat it with some really nice hydration. Then we go to the resilient hyaluronic acid technology. So this is our stretchier filler. Again, look, immediately when it comes out of the tube, you can see it's a completely different consistency. And then remember, we also talked about the much thicker filler, the deeper filler. This is ultra deep. This is going to be the one that's going to give the biggest lift, the biggest projection. And although immediately they may look quite similar, if you look closely, this is a much, much denser filler. That, you can see, can be spread very easily. That's free floating hyaluronic acid chains. This is our stretchy filler, and this is the one that's going to move dynamically with your face. And this is going to be your deeper filler, and you can see this is pretty hard to break up, and this is going to replace your hard fat that sits deeper in the face.
Now we're going to finish with your quickfire questions, and then I'm going to have a consultation. We're going to see if he can find anywhere to fill on this face, and if it needs it. My followers are so smart, they're so engaged.
I'm terrified.
I mean, trust me, they're hard to please, but they really know their stuff. So let's just go through a quickfire filler questionnaire.
Okay.
Can filler fix sleep creases?
Yes, it can. So if you think about a crease, it's a superficial crease. You would use a very light filler, so something like RHA1, stretchy, fine, dots along the line will lift that tissue up.
I've got a line through here that looks like I've been in a sort of fencing accident. It's not a fencing accident, it's because I shoot like that. Let's see. Oh, that's really excited me, that has. Is it a good idea to fill temples, and why? Because people talk about this temple filler, don't they, all women of a certain age, and men, I suppose.
Yeah, temple filler is absolutely brilliant. It's one of the key points that's almost undetectable. I mean, unless you're a bit odd, you don't really go around looking at people's temples. But what it does do is, if you've had temple volume loss, you can really reinflate that area, and it can give a little bit of lift to the eyelid in the corner. And also just, you know, as you get older, you kind of get that slight skeletal, sort of, it's called peanut head, which is awful.
I call it my father's face.
Yeah. Oh,
As I get older, I love my father dearly, but I just don't want to look like him. We used to call him Skeletor. So if you fill here, but he's very handsome, it's fine. If we fill here, you can get that slight, if it's true, somebody asked that, you can get that slight
Absolutely. So you can, I mean, obviously within reason, it's not going to launch your eyebrow to your hairline, but we can definitely lift it up by a couple of millimeters, and it lasts a very long time there. So it's quite a nice one to have sort of cooking in the background.
Okay, this is a really good one. This is the one that most women in their 40s want to know. Can a filler really lift a jaw or get rid of jowls?
So it's a good question actually, because what you can do is, there are many things that cause jowls. So the main thing really to bear in mind is that you have two ligaments that are sitting here. They're almost, imagine two palm trees, okay, and there's a hammock between them. These two ligaments are fixed there, and the fat is descending between them, and it's dangling down, and that's your jowl. So what you can do, rather than fix the jowl, is disguise it. So if you fill in front of that, up to the first palm tree, and from the second palm tree back to here, you almost create a whole new line that will almost sort of hide that palm tree. Does that make sense?
That makes complete sense. Under eye filler, good or bad? Now, I have to say, I did actually send Dr Wassim pictures of me with bad under eye filler that I had dissolved. I had the wrong filler in the wrong place and at the wrong area of my skin. It was put in too superficially. It seems to be one of the most contentious areas to fill. Do you find it interesting, difficult?
I do think it's interesting, and I think with this treatment specifically, it's about candidate selection, and sometimes it's not actually a tear trough filler that they need. So sometimes what happens is there is a bit of volume loss in the mid face, we call it, and actually just bringing that forward actually does help with a knock-on effect onto the tear trough, and that's almost an afterthought. So sometimes it is actually work in the mid face that's required first, and then we go to tear trough filler. But in the right cases, it's actually a really great treatment.
Whenever I see really good before and after tear trough filler, it tends to be on somebody with a very young, firm face that just has a little dent in here.
Absolutely.
Doesn't tend to be people my age who are older who have crepey skin and also have a histamine reaction, so my eyes are prone to puffiness. Just a warning there, it's not a one-size-fits-all.
But they would be great for the mid-face volumization, so indirectly treating it.
Yes, I would be. Thank you, Dr Wassim. I'm getting excited about this now. How do you fix bad or lumpy filler? Is it fixable?
Yes, of course it is. So you have two options. I guess one is to wait for it to run its course, which obviously sometimes it's understandable you may not want to.
How long does that take?
I mean, it depends on the type of filler, and again, the rheology, the density of the filler. So fillers can last anywhere from 6 months to up to 2 years in some cases. It depends on the texture that you're looking at. The other option is hyaluronidase, which is an enzyme which breaks down the filler. So we do have that in our sort of our cupboards, and that essentially breaks down the filler. It is a medical treatment in its own right, so you need to be tested beforehand. You have to have patch tests to make sure you're not allergic to it, but that's quite an effective way of just breaking down the filler. So it can be fixed.
So don't
panic. Long answer.
Yeah, don't panic. If it goes wrong, it's correctable, which is why you need to know what's been put into your face, people. How to avoid the Joker smile of lip fillers. That's another one that people are worried about. They're worried about the overly filled lip and then the overly filled face. That's the two most sort of obvious scare tactics that people are worried about.
The Joker smile, so what when it sort of does that and pulls up. I mean, again, it's about product choice here. You need a very soft filler for the lips. The tissue of the lips is very soft, and you want, I think the key with this is small amounts regularly rather than one big treatment expecting to get to the end goal. It's a fixed tissue, so you're going to keep adding and adding to it slowly bit by bit. Do it in stages rather than one big treatment, and I think your results will last longer. You're more in control of the result then as well.
Forehead 11s, that's the frown line. Filler or neuromodulator?
Really good question. So I would only treat this with neuromodulators in the first instance and do that for quite a long period of time and see how much reversal of the designs we get first. This is a very high risk area. So even if you were to go and have this area filled, you need to research your practitioner very well, but I would never do it without a background of having treated them with neuromodulators for a sufficient amount of time.
Okay, and now a two-part question. Are you ever too young to have fillers? And conversely, are you ever too old to have fillers? Because one of my followers who's just 53 was told she's too old, which is ridiculous.
Yeah, that's ridiculous. Well, to answer your question, so are you ever too young to have fillers? Yes, I think there was a law quite recently passed that anyone under the age of 18 could not have fillers, which we've all welcomed. No one under that age should be having treatments, any kind of cosmetic treatments really. I think, with the younger patients, you're looking at things like, facial asymmetries, perhaps a chin that's slightly set back to harmonize their profile. So they tend to be a bit more targeted treatments to correct perhaps asymmetries. So I think there's always a case for that. And answer the second part of your question, you're never too old to have filler because you're always going through the aging process. There are bony changes, deep fat changes, changes to your skeleton and all the tissues. So there's always somewhere where there's a tiny bit of volume replacement that can be used. But even sort of lips, temples, all these kind of areas.
I'm going to give you a curveball question. How old is the oldest woman or person you've ever treated with filler?
I've treated someone in their late 70s before.
Fabulous.
She was very, very cute.
Can filler erase a chin crease, or should that be a neuromodulator? I presume they mean that sort of slight one in there.
Yeah, so it could be a combination of both really. So what happens as we age is muscles get tighter, so the chin wants to do this and it kind of starts to develop this, it's called the labiomental crease. So I would do some neuromodulator treatments first, weaken that, and then you can come in with filler and absolutely fill it down. Look at your parents. If your parents have them, then you're probably going to go that way. So
we're back to looking at our parents again and deciding whether we want to look like our parents as we get older. Love you, Dad. Do fillers damage the skin? And then the other question that I got asked, which I thought was really interesting, is if you fill a face and then somebody maybe doesn't want to go back and have filler afterwards, does it cause skin laxity?
So no, if you think about what we were talking about before, your fat in your face, it's like a quilt, right? So you have different fat compartments in the face. Some get bigger and some get smaller. But the ones that get smaller, you're just reinflating them. They were always that size before, so you're just replacing the volume that was lost there. So we're not adding, copious amounts of volume elsewhere. We're just reinflating certain tissues. So that stretch was already there.
And then what about this idea of damaging the skin? I've actually heard the opposite, that actually filler can encourage the skin to create new hyaluronic acid and maybe even new collagen and elastin.
Well, probably the treatment itself, so cannula going through perhaps, or the needles going through will stimulate collagen to some degree. It's I guess some form of microtrauma you could say. But the opposite I wouldn't say have fillers because they would stimulate your collagen.
Okay. And then the all-important question, how do you find a really good practitioner that will understand what you want and use the right product in your face?
It's a good question actually. So at Teoxane we did a lot of the vetting process for you. So we picked practitioners that we've trained. They're on our platform, the Teoxane platform, and only sort of trained registered healthcare professionals beyond there. Obviously other things to look for are if they're insured and make sure they're accredited by their certain governing bodies, but yeah, we've got them on there.
I'll put the link into the clinic locator.
Yes.
Yeah, below, don't worry. Can fillers help line around the mouth? That's the other question people always want to know. I presume they mean these, but they might also mean those classic smokers' lines.
The barcodes.
Yeah.
The barcodes, yes, they can do so. A couple of things will be causing that. They're not due to smoking away, so lots of non-smokers have them. But yes, a thinner filler you would use targeting the line specifically and into the fat underlying that area. It's sort of deflation that's going on there and the skin tends to crinkle, so you're just pumping it up ever so slightly.
And then what about these ones here?
So these ones are interesting. We actually, so when I first trained, it was the first thing I learned was to fill this, and everyone walked around looking a bit like that. So now what we do is actually do a little bit more face.
Planet of the Apes.
Yes, exactly.
It's the Planet of the Apes look. That's so old-fashioned. Yeah. In those days, it was about chasing the line, and now we don't think about it that way at all, do we?
We think about what's causing that line, and what's causing that line is that mid-face volume loss and the bone sort of moving back. So when we reinflate the cheek, the idea is the knock-on effect is to lift that tissue and create some sort of reduction of that line.
How often can you have fillers? How often should you have fillers?
I mean, obviously, it will depend on how the individual filler itself. So some of the lighter ones will last a shorter time than the longer ones. The longer acting ones will last upward 1 to 2 years. So you're not going to be doing that before then, but it's something that you would agree on with your practitioner.
How many treatments would you ideally like to do before you're at that point where you say, right, I've done enough now for you? Would it be sort of 3 or 4 treatments?
Yeah, I tend to try and do 3 treatments if possible. I think also people this whole subject's about filler phobia. People don't want to look like they're done, so it's quite a nice way to show them where you're going with the treatment. They feel that they're in control as well, so that you never have that problem of overfilling, just stagger it.
I always think that the best people I've ever seen, any aesthetic doctor, it's about under-treating and asking you to come back and keeping an eye on you. Not only that, should you want to then pretend you haven't had any treatment done, you're not suddenly going to look different overnight. You're going to see it over the course of probably 3 treatments over maybe 6 months.
Yeah, exactly that. Shorter even, could be every sort of, every 3 months, over 3 months.
Over 3 months.
Yeah.
But that's a really subtle, nice change, and you feel much more in control of that journey as well. We're coming up to the final few questions now. Does filler work on necklines or chest lines? Old lady chest lines is too much sun damage.
Yes, you can use it. So, one option would be skin boosters, which would be to sort of really smear out the hyaluronic acid across the décolletage, but you can actually target the lines individually as well. So we have something called RHA1, which is that stretchy filler, because the neck is a mobile area.
And that's those lines,
line, yeah.
what do we call those? Necklace lines?
Necklace lines.
Yes,
necklace lines.
It's a polite way of saying it.
So Nadine, we were going to talk about sort of the aging process and areas of the face where perhaps we would discuss filler as an option. Now, my gut instinct is to say to you, I don't think that you need filler at all. I think that you look incredible, actually, and the volume in your face is actually where it should be when we're talking about certain decades of age. But some of the areas that we can treat with filler, or certainly points that I can point out, I think we'll start in this area, because this is really where I think, if we were going to do anything, which I've decided we're not going to, but should be thinking about it. As time passes, we get something called bone resorption around this area. So this bone starts to essentially melt away. And what happens is you get the appearance of this area almost feeling like it's setting back. This area, we have this fat which starts to descend and get bigger. And it's pegged down either side by 2 ligaments. So this area is called the jowl fat, and you can see just in front of it there is a slight bit of shadowing which accentuates the shape. So if we were going to, I would put some filler just between that jowl and the chin, just to give this a slightly smoother contour. And that is pretty much all I would do, and you'd have to be twisting my arm to do that.
What about
temples? Again, so we looked at your photos, remember? And I looked at your photos, and you didn't have full temples to start off with. So when I look at your photos and I see you through the decades, I don't think you've had temple loss. And the biggest mistake you can do is to add volume to someone who never had it there in the first place, because it's going to change the shape of their face. So while temple filler is actually very good treatment to lift the eyebrows, or with someone who has quite a lot of age-related volume loss, the temples are looking great. I wouldn't, it would look too different to how you looked before.
So there you go. You needn't be frightened of filler, or, as Dr Wassim says, filler phobic. Filler can be right for certain faces, but it's not necessarily right for all faces. And trust me, I tried to strong arm in into giving me a little bit of filler. You're in safe hands if you choose the right healthcare practitioner with the right filler. It's the magic combination that you need.